Hello and welcome to the second installment of Jammin 98.3's Conversations About Health, a two-part series brought to you by Ascension, Wisconsin. Your care is our calling. We are Wisconsin. And it's also brought to you by Wisconsin Alzheimer's Institute. April is, of course, National Minority Health Month, a time to raise awareness about health disparities that continue to affect racial and ethnic minority populations and encourage action through education, early detection, and control of disease complications. I'd like to introduce you to our panel of guests, Dr. Tamarah Duperval-Brownlee. She's a Senior Vice President and Chief Community Impact Officer at Ascension, and she's the President and Chief Executive Officer for Providence Health System in Washington, D.C. She's a healthcare and clinician with over 20 years of experience of improving the health of communities. We've got Gina Green-Harris. She's the director of the University of Wisconsin School of Medicine and Public Health Center for Community Engagement and Health Partnerships in Milwaukee. And we're also very pleased to be joined by Dr. Kweku Smith. He is a licensed psychologist in the state of Wisconsin, a product of MPS. He continued his education at the University of Wisconsin-Whitewater, where he earned a Bachelor of Science in Psychology. He has a Master's of Science in Educational Psychology from UW-Milwaukee and Doctorate of Philosophy in Urban Education with an emphasis in school psychology. So happy to have you all here today. Thank you so much.
Thank you.
Thank you.
And we know that the spotlight for the last year or so has been on the disadvantages that African Americans have faced while facing and fighting COVID-19, but it has been an issue for decades that African Americans are generally at higher risk for heart disease, stroke, cancer, asthma, influenza, diabetes, HIV, AIDS. I could go on and on. So our hopes today is provide information that can address some of those things and give our viewers a few ways to approach their health and health concerns with important information, and as well give them some resources to help them along as well. So I'd like to give each of you an opportunity to tell us more about yourselves and what it is you do on a daily basis. We'll start with Gina there.
So thank you so much for having us on the show today. And it's definitely an honor and a privilege to sit with such great leaders in their respective communities. So Andrea, it's so good to see you as always, fellow Centralian, Marauder. But wanted to just a little bit about who I am and what we do. So about myself, certainly with the University of Wisconsin-Madison, from Wisconsin, but really has had this opportunity to serve our community in the capacity of leading programs using asset-based strategies and studying the development of community-based strategies that are based in the need of the community, the desire of the community, and really allowing the community to lead and we follow, right? And so in my role currently as the director of the Center for Community Engagement, one of the critical pieces that I do, and I'll talk about the Alzheimer's in a second, but one of the most critical pieces we're doing right now is really helping our investigators and our academic faculty understand how to engage communities of color effectively using a cultural lens. And that's the first time that's happening, really saying to investigators, it is really important that you actually be trained and understand that you can come in our communities, but you're not always the experts when you come, and recognizing how to step back and become servant leaders within our communities. And so that has been one of the pieces that we've done with the Center for Community Engagement. We also do our Alzheimer's disease work, as you know, and that too has been a love strategy that we've used, using the assets of the community, but also recognizing the community through research needs service delivery. So we've created these service delivery models that are forcing our community and our academic institutions to, again, recognize that we're using a resilience model as opposed to a deficit model. And that has been really one of the assets that we've been doing that have given us the opportunity to strengthen families through our chorus work that we'll talk about, through our research opportunities that we can talk about, and then our community service and our programs and delivery service model that we've created over the last, I'll say 13 years now. And so, my background is obviously in cultural competency. I do tons of training now around that area and along with asset-based community development. And as I'm working on my PhD now in clinical investigations, really trying to identify strategies to build on how do we create this new pipeline, quite frankly, for Black investigators, Black and Brown investigators, to actually have their own research so that they're not subject to others' laboratories at this time. So I'll stop there. But thank you so much for having me.
No, thank you for sharing that with us. Dr. Tam, if you would, please.
Absolutely. Good afternoon, everyone. It's a pleasure to be here. Thank you, Andrea, for having me. I feel like I have a kindred spirit with Dr. Gina, Dr. Gina, in terms of what she shared. But I'll formally share a bit about myself. Tamarah Duperval-Brownlee. I am a physician, a family physician, and originally from Chicago. And it's also important to know about me. I'm a first-gen American. My parents are from Haiti originally, and I share it because it shapes so much about my lens of thinking about what I do, and my North Star really is to ensure that everyone has the opportunity to live healthy and well. And it's really shaped this journey of advancing health equity that my career has been about. I've practiced medicine and led physicians, to provide quality healthcare, especially in communities that have been historically underserved and underrepresented for over 20 years, mostly in Chicago, but I've also had a privilege to do it in a few other places. And along the way, I can't help but thinking about the people that I was treating and was serving, that they are my sisters, brothers, cousins, et cetera. And I couldn't shake the questions about how we could do this work better, especially working in community health center settings and federally qualified health centers, and really tackling injustice, that I was seeing. And removing the assignment of poor health outcomes that we see in African-American communities to the people, but rather to the systems that actually cause them to be marginalized, to be made vulnerable, that people weren't paying attention to. One of my favorite quotes that I think about in the work of advancing health equity and providing quality care is Martin Luther King, of course, that talks about, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane, and that's really been my mantra, in terms of the work that I've done over the past couple of decades. But even with Ascension, Ascension is a large nonprofit, faith-based organization that has many sites of care throughout the country, but I'm particularly proud of the work that's being done in Wisconsin. I've had a chance to visit and be a part of a number of pilot programs there to address these issues of injustice and inhumanity that's happened there. I'm really excited about the impact that we're making. That said, there's a lot to be done. In my work at Ascension, where we're really mission focused to care for all people, but with a special emphasis on those who experience poverty and have been made vulnerable, community impact is this body of work that actually looks at assessing social risk that's experienced by people and making sure that informs the care that we're providing for them, whether you're in a clinic, in the hospital, in the urgent care, wherever it is, making sure that wherever you're getting the care is equitable to you. The second pillar is community engagement and partnerships. So just ensuring that, as Dr. Gina mentioned, that it's really having to amplify the work that's being done in communities that's often quite effective. And too often healthcare providers are engaging only when we need something. And we want to turn that tide to say that we want to actually address what matters most to the communities where we're serving. And then the third pillar, which is a newer body of work, but I'm so excited about, is that if we're really going to get to a place where we can actually achieve equity, that everybody really has the opportunity to live healthy and well, we need to make some real key strategic investments. That comes from the healthcare system, but it also comes in partnership with organizations that are already doing good things in the community, but need to scale on a greater level. So, addressing economic stability, for example, not the usual business of healthcare providers. But I know that if we can turn the tide about people feeling like they can earn, they can provide for their families, provide those basic needs like food and housing, transportation, then it's easier to make health a priority. Not that they're not motivated, but it's a bit easier. So I'm really excited about the conversation that we're going to have, and really appreciative to be a part of this.
We appreciate you being here. Dr. Kweku.
Oh, well, thank you very much first for allowing me to be on this dynamic panel. When people ask me what I do, it's always very difficult. So I try to sum it up in 2 words, and I say trauma and performance. As a licensed psychologist, a lot of times people say, well, what do you do? I've had the awesome ability to work in the school system, to work in a correctional setting, to work with professional teams, and also to work within hospital milieus. And in doing that, I found that everybody goes through 2 things. We all go through some form of trauma, obviously marginalized communities even more. But despite the trauma, we still have to have a level of performance. So how do we perform despite that? So in working with all of those entities that I talked about, I learned that a lot of our trauma happens in our childhood. So it goes back to, how do we get a knowledge of self? How do we have a love of self? How do we start to have a level of self-efficacy? And in going through those different dynamics that I talked about, what I recognize most importantly is everybody needs to have a level of self-knowledge, a level of self-care, and in self-understanding. And in doing this inside of my practice, I found that through the art of speaking, through the art of writing, through the art of being able to have people to talk, to do self-introspection, they're allowed to do certain things. So now currently what I do is, and I'll say Dr. Gina too, I'm gonna put that in the atmosphere. What we're gonna do is I do work with the Wisconsin Badgers, specifically with their athletics department, and working with the young athletes to help them perform, not only on the field, but also to do well just in life in general as they matriculate through life. But simultaneously with my company, I get a chance to do all of those things that I talked about before. I get a chance to write curriculum for schools to kind of help as it relates to diversity, equity, and inclusion. I get to write with the federal government, creating curriculum for those who are incarcerated. So while they're at that time, they can really be reformed. So it doesn't have to be the penalized system that it is. So I love that I get to have a hybrid system. But inside of all of that, from a human standpoint, I would be remiss if I did not talk about the Brothers of Omega Psi Phi fraternity, which I get to do a lot of my civil rights, civil activism rights through. And so when we combine those 2, I think it's a love of heart and humanity for our community to be able to help every sentient being maximize their best potential.
Yes, indeed. And since we have you talking, I did want to mention your company is Blaquesmith LLC, and something that's top of mind right now. So we'll get right into the mental health component of things. You provide training and support on the topics of violence prevention, as you said, trauma, informed care, social justice, and human trafficking. But let's discuss the trauma and the PTSD-like trauma that is triggered when we see Black death go viral. It has happened time and time again. We see it during traffic stops, jogging while Black. That's the driving while Black during the traffic stops, and just being Black. So if you would address the recent scenarios involving the death of George Floyd in particular, what does seeing those type of videos over and over again do as an individual when people kind of think, well, it's just a video? But when you are a person of color, and I know this is for me, when I heard that verdict being read, I couldn't help but cry, because George Floyd could have easily been my brother, my father, my uncle, my friends. Any Black man could have been under his knee. So it's not just a video of one person in particular that we're supposed to just get over. This is something that we all live and feel for so many different reasons. If you would address that.
Yeah, I mean, it's a big, big thing. And I think what you say, it goes into our ties of consanguinity from the beginning, because whenever we see death on a Black body, it cannot help but do anything but trigger our cellular DNA, where we begin to think about our ancestors. I hear Dr. Tam, I want to say sac passe, because I see my brothers and sisters over in Haiti, and I say, you know what? It's just a different level of both stops. So even in South America to Brazil, how we've been, torn apart from the diaspora. But whenever we see something like that, I think it, like I said, it goes into a cellular level and re-triggers our DNA memory from all of the hurts and the pains of even our ancestors. And when we see it, we look at all of the ways the great Derek Bell, the father of critical race theory, says the more things have changed, the more they stay the same. And I think what it does, it reminds us of, you know what, we're improving. We see all of our people doing things that they never done before. But at any given moment, at any time, and I think if we can just umbrella it, Andrea, we say, breathing while Black, because we know no matter what we do, sometimes it's the very skin that we live in that becomes the instrument of torture, of terror for those who have been labeled as colonizers. So you say, what does it do? It reminds us every day that no matter what we do, even if we're walking with a hoodie, even if we're sitting on the park, that anytime it could be us, it could be our mother, it could be our father, it could be our friend, it could be us. And so what does it do? It reminds us how fragile life is. And no matter that, even if we do the right thing, it's still there. And so why do you say that's important? Because whatever you do, whenever you live with a certain level of fear from a biological, especially neurobiological, we talk about the stress cortisol, the stress hormone of cortisol being released. And when this is excessively released, it then depresses our immune system. And what Dr. Tan was saying before, when we look at why from all social determinants, we're always on low levels from the grave, from the cradle to the grave, it was because we're born with a certain level of stress inside of us. It's always that fear of what can happen. And then when you walk in a level of fear, when you walk in a level where you're not always operating at your best, it creates you not to be able to maximize yourself, but to flip it, because whenever we talk about mental health, it can become depressing. It can become sad, and that's why people run away from it. But that same cellular DNA that we have that reminds us of that trigger, we're also reminded of the level of resilience, the level of power, and the level of how we're going to overcome. So like you said, when you started to feel that heartbeat, when you were waiting for the verdict, because you said, are they going to add insult to injury? Because we knew he was guilty, whether they said it or not. But to hear it was a relief. And it's sort of like the words of the Black national anthem come true. You know, it's like this hope that we're waiting for, that we said is going to come. And if we can repeat Dr. Martin Luther King said, he said, I've been to the promised land. I might not get there with you, but I'm going to get there. And it's those type of words that let me know that if we keep pushing, we'll get there. But that trauma is real. But if we don't activate it, if we don't recognize it, if we don't begin to deal with it, it can overcome us. So to your point, you said, why does it traumatize us? It reminds us of the actual fear that we live in on a daily basis. But to do that, what we have to recognize is that we have the power, we do have the agency to make some changes. And the fact that people say, well, this is just one time. Well, this is one time that it didn't happen before. So how do we build upon this? How do we take this kairos? How do we take this moment and galvanize it like the civil rights moments of the 60s, put our collective brilliance together, put our collective power together to take us to the next level? And that's how we overcome the trauma to performance, to say we're nowhere in the midst of despair, we're nowhere in the midst of pain, but yet we still have the ability to overcome. And if we come together, there's nothing we can't do collectively.
Absolutely. Thank you for that, because I feel like there should not be anxiety from Black people just leaving the house, or a Black mother worried about her Black son leaving the house, because we all know what stress can do to the body. And so here we are talking about all these disparities and these higher incidences of high blood pressure and things like such. It all goes hand in hand. And that's why it's so important for us to talk about it today. One thing I did want to bring up with you, Dr. Tam, is infant mortality, because there is research that shows us that really the numbers, you have African-American infants that are 3.8 times as likely to die from complications related to low birth weight as compared to non-Hispanic white infants. So talk about the importance of prenatal care, because we're talking about that stress on mothers, and talk about what Ascension's doing to actually address this concern.
Yeah, thanks so much. I want to just add a +1 to all that Dr. Kweku shared about these ties between what's happening in our minds related to stress, and that it creates this very physical response that is carried, and Black mothers, you know, carry this to a great degree. There's a really powerful concept that Dr. David Williams out of Harvard talks about called weathering, you know, that kind of speaks to all of the events and micro traumas that people of color, people who've been made marginalized feel, and that despite education, despite you know, achievements, despite even wealth levels, it just tends to dampen outcomes, you know, the weathering effect in terms of the maternal outcome. So for example, I remember doing a study where I was looking at women who were, you know, born in the United States and thriving in their birth outcomes. And I compared them to women who were foreign born, you know, and the interesting thing was, and these are all women of color, women who were foreign born actually had better outcomes, like that first generation, you know, after they just got here, despite, you know, living in community with people who are American or native born. but give it a generation and all of that extinguishes, despite the fact, the cultural things of foods and how families interact with one another remain the same. So what's happening? It's this weathering, it's the trauma, it's the, aggressions, it's the stress, it's not being heard of. So for us in Ascension, especially Ascension, Wisconsin, we double down and say, we need to really take the bull by the horns and launch a maternal health initiative so that we can let mothers know, we hear you, we see you, and we don't assign the blame of poor outcomes to you, but we want to walk hand in hand with you and really provide the things that are necessary for you. So some of those barriers, as you might alluded to, Andrea, were about being able to get prenatal care, and what that's about. So thinking about everything from access to health coverage, to getting regular screenings, finding physicians that they can trust, were all things that we wanted to be able to tackle on from the very beginning. When we started to lean in closer to women and really hear them, because, medically, I know what I'm supposed to do for you, right? I see you, I treat you, I prescribe you prenatal vitamins, I tell you to come see me every 4 weeks, whatever it is, so that we can have healthy mama, healthy baby. But as we listened closely and to our patients, we learned like more than 40%, of those moms had issues with food insecurity, that were being cared for in our centers. And even though they qualified, for women and children benefits, they weren't enrolled, and so we kind of had to dig deep as to why that was and remove those barriers so that this journey is really complicated. You got to go here to sign up. You got to go here to get your benefits. You got to go here to get your care. So how can we make that all one-stop shopping? We also address the issue, like there's an old father of medicine, Osler, that says, the cure to hunger is feeding people. And that's exactly what we needed to do here for the moms, is provide them with food. We've created this maternal food access program that actually provided boxes of food to women that was actually good food, culturally appropriate food, so that they could get the iron and the folate that they needed to prevent the low birth weight that happened or the anemia in moms, so that they would, not have a better outcome for both thriving as well as living. And then we learned about other things like childcare. It's not unusual that you're mom to one, you're mom to three, so how do we actually manage that so moms can actually get to their doctor's appointments? Transportation, by subsidizing those rides, with a rideshare program. One of the latest things was the obstetrical ED, where we can have 24/7 access of obstetrical and even specialty care to women when they need it. It's one thing to have a relationship with your doctor that you can trust, but if something goes awry and you become high risk, how do you get to that specialist? Do I know that specialist? Is that specialist going to talk to my doctor? So the brilliant team there in Wisconsin created this obstetrical ED so that women can have easy access, especially in emergent conditions, but it actually bridged that gap, so that when they're in trouble, they're heard, they're seen, and they're treated. So those are some examples of what's important. I think the headline really is that people want to be heard, people want to be listened to, and too often, a Black face, frankly, is being seen and concerns and symptoms are minimized. If there is a greatest injustice, it's what we do to Black moms, in this country, and I'm so proud of the work that we're doing. There's still a lot of work to be done, but these are making a difference.
Yes, and anyone that's watching can contact Ascension and find out more about that maternal food access program. Also, you mentioned the child care that's in place. So if a mom has a doctor's appointment, there are nurses who actually are set up to watch your children so you can take care of your business. And there's also the scenario with food insecurity. I know you have a partnership with one of the local churches where people are able to stop by and get the food that they need. And you also have a program set up for that transportation. So we'll make sure before this is all over that you can provide us with a phone number and a website so people can get more information on that. And Gina, I guess I should call you Dr. Gina. Everyone else has already graced you with that title. And I love the fact that you are working towards adding to your expertise because you work in so many different areas. You and I have had conversations about the Life Course Initiative for Healthy Families, which is also an initiative that addresses infant mortality and prematurity at the University of Wisconsin School of Medicine and Public Health's Wisconsin Partnership Program. But I wanted you here today to talk about Alzheimer's, because when we have a lot of conversations about health, that's not something that always comes up. And I know there are countless people who are taking care of their loved ones day in and day out. And sometimes they're at the bottom of the list when it comes to taking care of that loved one that needs them, taking care of their family, and whatever else needs to be done. So just some statistics for people who may not know. African Americans are twice as likely as non-Hispanic white Americans to have Alzheimer's disease or a related dementia. And in fact, African Americans have higher risk of dementia than any other U.S. ethnic racial group, and more severe consequences. Knowing that means that we need more information to make sure we have early detection and know where to go and where to turn when we see our loved ones starting to forget or maybe not being themselves. So if you would talk about why those numbers are the way they are.
Yeah, so again, thank you. And to Dr. Tam and Dr. Kweku, I want to thank you guys for pushing me and Andrea and that thought. But, I do want to talk about Alzheimer's, and I just want to acknowledge, it's interesting that this conversation, if you notice, the theme is around mental health, right? And the reality is that Alzheimer's is not even different than that, right? It's a lot we often think of Alzheimer's disease as our elders, right? Our olders, our 85 and older. Well, that's not always the case. And then often what we do know is that Alzheimer's disease actually develops in the brain 20 years earlier than signs and symptoms show up, right? And why is that critical? Because especially Black folks and brown folks of particular marginalized communities, we're already dealing with maybe some Alzheimer's characteristics. Add that stress upon that, because stress is really impacting, how we trigger all of our health. What is it that it gets under our skin? Disparities and racism gets under our skin, literally, and impacts our health overall. Alzheimer's disease is no different, or dementia is no different. I should probably share with the community that. So dementia is the umbrella, it's the overlay, and Alzheimer's disease is one of the more common types of dementia. And what makes Alzheimer's and vascular dementia different than other dementias is that it's irreversible. So someone could have depression. Depression is also acknowledged as a form of dementia, but it's treatable, meaning that you can go and you can actually, once diagnosed, get something to help it dissipate and or disappear. Alzheimer's disease is not like that. And that's why it's really important for the community to understand the difference between what is a dementia that is irreversible versus reversible. And also that Alzheimer's/dementia is not just something made up in the brain. It is just not forgetfulness. It is more than forgetfulness. It is literally your brain being destroyed by a disease, meaning that your brain will be deteriorating due to this disease because of the snaps and the tangles and all of those things. And so I want to share that. I like to share that with the community. It's more than just forgetting milk at the store. That's not what this is. It really is about something that says your brain is not talking to each other. The synapses are not talking to each other, and you're missing, and the firing is not happening. And so there are some real physiological happenings in the brain. And I have to say that because in our community, we are typical to say, we're often saying, oh, she just doesn't believe me. She just doesn't want to forget. She just doesn't want to remember this. Alzheimer's is not selective. It's not Alzheimer's, it's not selective. It's Alzheimer's, and it's not selective either, right? So I have to say that because we call it a lot of stuff, right? I just have to keep it real with our people. And the reason I like to say that is, again, when we think about this from a mental health perspective, what's the first thing we do every morning we wake up? We thank God for our right mind, right? We do that, and it's okay. But Alzheimer's is not taking you from your right mind. It is a disease that is destroying your faculties of your brain, and you need to separate that. And so I want to say that. Now, as to why and how, why us? Because of all of the things you guys just talked about, because we do suffer as a marginalized community. When you think about Alzheimer's disease and access to care, more than, there's a recent study that just came out in 2020. The Alzheimer's Association just released this new study around race and Alzheimer's disease. And over 36% of African Americans believe that if I go to the doctor with my Alzheimer's issues, I will be discriminated against. That's pretty powerful. So you're telling me I need to get a diagnosis, but I believe that the people who can diagnose me are going to discriminate against me. How many times, the question was, what percentage of you say that you have been treated in a condescending manner? Over half of the people of color indicated they were treated in a condescending way. Mm-hmm. And that's really critical to care. So it's not enough to say we have these care facilities in the community. No, you got to have culturally inclusive, culturally confident care. And I use the word confident out of Dr. Stephen Thomas out of Maryland. It's a study called Building Trust, and now it's talking about how do you address this issue of cultural confidence versus cultural competence. And it's relative to Alzheimer's because confidence says I only have enough information to talk to you in this moment. Competence, on the other hand, says I did this class, I got all my certificates, and boom, I know exactly what you need to do. No, that's not how this works. When you see one person with Alzheimer's, you see one family or one person. Confidence says, bring your family because I need to hear what's going on in the ancillary circle. That actually reduces our mental trauma because I need to be able to be in that space with my family to share what we've been acknowledging and seeing and knowing and feeling comfortable that this provider is going to hear our story, hear what's going on and traumatizing our family and making the disease more real and actually reducing the stigma around Alzheimer's disease. And I know that might sound pretty simple, but that's pretty complex when you think about all of the other stresses we have. When you think about the care partner for people with Alzheimer's disease, it's typically African-American women who are middle-aged, who are still working, who are still raising families, and then trying to take care of their loved one with Alzheimer's and dementia. And that even goes to say that even in this current climate, people are developing dementia earlier. That earlier onset dementia is happening more often in communities of color. And I believe based on systemic racism, the stress, and just all of those entities that are continuing to bombard us with how we as a community are trying to live. Also think about this. Remember how we all grew up with this interconnected, this inner circle of families that were all in the same. So nobody knew no one knew we were poor because we borrowed and bartered, right? So if I didn't have sugar, you had sugar, which I mean I had sugar. Now, that's how we grew up, right? But think about the generation that's growing up now without that same type of support. So if I've got a loved one who's suffering from Alzheimer's disease, let's talk about this. I'm the primary caregiver. Where is my support? Where is my support unit? And I don't have that because my neighbor may not be willing to give me sugar because they don't even know who I am. That makes a difference in the type of care that person with dementia will receive, because it used to be neighbors coming around. They knew who had what. They knew to call it Alzheimer's or dementia, but they knew something wasn't quite right. Today, we don't have those same kinds of support systems. And that too is a problem. Access to getting a good diagnosis. The new data shows that over 50% of providers say they don't believe that they have the capacity to care for the numbers of people who are expected to get dementia over the next several years. That's pretty profound. When you quote Andrea, 1 in 3 people will get Alzheimer's disease. If African Americans are 2 times more likely to develop Alzheimer's disease, what do you think that looks like for us?
Yeah.
And when we think about the racism in this country and the marginalization that happens with access to good quality care, how is that going to impact us in years to come? And those are the questions that we're asking. And so our program is really designed specifically to address the needs of communities of color in the heart of the community. Our programs are designed to have partners such as, we work with Ascension too, so Dr. Tam, we can talk about but we work specifically with organizations who are boots on the ground. Our program, we have a staff person who helps these families, just like what we do with infant mortality, to If I just got a diagnosis of dementia and my caretaker doesn't quite understand it, the provider's not explaining that for us. We need a conduit to do that. Our team literally sits down, goes into the house. We've done Sunday dinners, we've done family picnics, and we express what is this dementia and how does the family need to rally around and the church need to rally around or your other social supports to make sure this is happening so that that person who's going to be that primary caregiver is not burnt out. There's another statistic that says that caregivers for people with Alzheimer's disease typically die before the person who is living with Alzheimer's disease. Caregiver burden is real. The cost for caregiver burden is astronomical in this country. And the reality is that a lot of our employers are not sensitive to that. Now, picture African Americans in an employer situation as doctors have already talked about, both of the doctors. The reality is that if I have a job where I can't get paid for loss or sick time, or I have to risk having a job or caring for my loved one, what does that do for my stress? So the question is, what is Alzheimer's disease going to look like for the next generation, right? Mm-hmm. It's some genetics that are involved with Alzheimer's disease, but the reality is that a lot of the lifestyle habits we can think about changing, but if we are overstressed and overwhelmed, we are also setting ourselves up to be victims, or I shouldn't say, yes, to be victims of Alzheimer's disease or some form of dementia. So I will stop there because I can go on, but I think what the theme is for me is understanding that, the data is there. The data clearly shows that we are a marginalized population. We're getting Alzheimer's disease more, and it's more deadly for our community. The questions that we're raising and posing is, how do we create now these infrastructures within communities based on the assets of the communities to help save lives for the longevity? Because there are some things that we need to start doing to offset and prevent and reduce the risk for people to get dementia. And so we've created all of these programs, dementia wellness programs. We've modified them specifically for communities of color to build this. We've built a chorus, the Amazing Grace Chorus, that serves the community well, and again, partnering with other organizations to do that work. So I will really stop here.
I will also, great information there. And I will also have you give out a website and phone number as we wrap up the conversation for our viewers to take with them for those resources. But I just wanted to add this to what you were saying. I know there's a lot of research being done to better Alzheimer's, but a lot of studies are based on non-Hispanic whites. So we need people of color to understand that when these programs that come from organizations like yours and others that we have on the air here at Jammin 98.3, when they are saying we are researching and we're looking for information, that is so that they have better information that pertains to people of color, our DNA, our life experiences and consequences. So I know there's a lot of history that says, you know what, we don't do research, we don't get into that. But we are in a day and time that lack of research is hurting us as well. So you find that trusted source that you can go to and move forward in understanding the importance of that. So because I don't want us to run out of time, but each of you have given us some great information, and it all kind of comes down to just dealing with stress and how that leads to all these other things. It's almost like a tree with branches. So if we could, with Dr. Smith, and I want everybody to just please give us a nugget. What does self-care look like? Because we all are doing a lot, not because we want to, but because we have to. We have our families that depend on us, and the list goes on. So, Dr. Kweku, if you would, in your opinion, what does self-care look like?
It looks like a few things. And so what I say is it's an individual basis. So you know what you like. It's certain things that I tell people is 3 things you absolutely have to try to do. And those are things that we all can do to some extent. That's eat right, Let's get enough sleep and exercise. Some of the things that's within our parameters to do, as much as we can control, we want to try to do those. But those things that make you feel good, those things that give you that time away, you have to make sure that just like we are caregivers for others, we're caregivers for ourselves. So take time for you to be able to laugh, to be able to rest, and not feel guilty about it. But I'll tell you another thing too, and it kind of goes into the caregiving thing, but the opposite end. My grandmother from Chickasaw County, Houston, Mississippi, used to tell me all the time, the best way to heal yourself is to help others. And I never understood that till I started taking neuropsych courses, and from a level of these, if you want to say, neurochemical transmitters in our body, from serotonin, dopamine. Whenever you do something good for somebody else, it's a reciprocal feeling for you to do for yourself. Now, what you have to do, though, to go with Gina's point, is to make sure there's a limit. So I say, one, take care of others to a point that's healthy, giving back to others, but then two, also making sure you take adequate time for yourself.
Yes, thank you for that. Dr. Tam, your thoughts on self-care. What does that look like?
Everything that Dr. Kweku said, and I will say, don't make it so complicated. You know, there's so much talk about self-care these days where people feel like, do I need to go, away, somewhere away from my, my home or my community, which is a little harder given the pandemic, or does it have to cost? And it doesn't. Yeah, maybe I'll just plus one on the three things that he mentioned with eating. We have a lot of shaming when it comes to eat, and eating in this country. And for us as a community, we see recovery as part of, taking part of the comfort foods, that are part of our tradition, and that's okay. And as a physician, I'm telling you, it's all right, but everything in moderation. Your body needs fresh things. It needs water. It needs, a balance of proteins that are animal and plant, in that regard. So know what's right for your body. I can't say enough about sleep, however, and it ties so brilliantly to the work that Dr. Gina talked about with Alzheimer's. A key risk factor in any memory disorder that may happen in the future is this chronic lack of sleep, which is often complicated by the stress, that you experience during the course of the day. So, it's easy for me to say to get more sleep. But I would say get into the reasons why you're not sleeping. Are you eating too late? Are you plugged in to these devices and experiencing all this blue light too close to when you're, amen, too close to when you're supposed to be going to bed, So that, I think those are really key. Really, is your environment actually conducive to sleep? Is it noisy, or is it just too much going on? And I during the pandemic, of course, we did a lot of things. In bed, I worked, I slept, I ate, read books. It's leave your bed to sleep, and then that's super important. I would say the new thing I would add to all of it, and I'm a big proponent of movement too, is micro recoveries. So sometimes it's not this big thing. You can't afford to take a whole day off, right? In order to do self-care. But, in the middle of the day, I do this about 10 hours a day, now, because this is the way we work. For me to take 3 minutes, be quiet, take some deep breaths, center myself, and think about, what is your goals for today? Are you still on track? Doing some meaningful stretches, eating something, but just listening to feedback, about how your day is going and what you're doing is enough to reset, instead of having a mindset that's negative or things that are happening to me. 3-5 minutes, where you're really taking the moment to say, I'm going to reset right now, I may be 3 minutes late for that meeting that's coming up, but I need this for me. That's self-care for me, in order to take care of myself, or not being on camera, for a meeting. It won't work here, but certainly, not being on camera because there's such stress related to that. So everything, again, that Dr. Kweku said, but I would add micro recovery steps that works.
Okay, thank you. And if you would, Gina, kind of add to that.
Yeah, so of course, Dr. Kweku, Dr. Tam hit him on the head. I think if I were to add a few things, one, I would add the notion is that we don't have to be superhuman. Release yourself from that thought. It's okay to be you, and it's okay to say no, and it's okay to step back. And I think those are huge for all of us, especially now, because we're always expected to be on. So I think that's really important, something that I'm learning over this time. I think the other thing that I think has been critical is because the narrative has been written for us for so long, it's time for us to actually, self-care for me is writing the narrative myself. And the way to write that narrative ourselves is to really invest in learning, relearning our history, right? I still love Carter G. Woodson and the Miseducation of the Negro. That's still my favorite. And Maya Angelou, I go back to those places. And W.B. Du Bois. Relearning our history to rewrite the narrative around us is self-care for me, because it reminds me that I'm not the people that are on the media. That is not our history. That is not who we are. And we get the opportunity to write that narrative now, because we can then, when we see that, and we can pour into our young folks, right? I love Dr. Kweku giving back what your grandma said. It's about sharing those pieces and nuggets of our history with our community that really gives that better self-care, because now our mental mindset is that 3-minute break. Oh, you might write me down in history. Oh, but here's what the real work says, right? When we start, and it's really what I've been starting to do in all of my presentations is start off with my colleagues by saying, did you know who created the iron? Do you understand who Dr. William Hale is? What do you understand? That's really a way to start addressing and reassessing who we are as people, not for my sake, but for the sake of those who don't know, and then reframing. So those are 3 things that I think are helpful for self-care. And again, sleep is important. Good sleep is important. Step away. If you don't hear anything else I say, shut the world out and don't be afraid to say no. It really is a full sentence. It's a no with a period, an exclamation point, but never a question mark. Just let it be.
Yes. Oh, I love that. And just know I'm taking away those nuggets too. Next person that calls me asking me to do something, no. Just saying it. Right? No, I'm kidding. But no, you're absolutely right, because we always sometimes feel the need to fulfill that request and you've worked hard to get to the place where people ask you to lend your expertise or do what it is you do or talk to a group of people. But you're right. Sometimes you have to peel that S off your chest and realize that, you have to take a step back and you can't do everything for everybody. You've got to find some time for yourself. So a couple of things I just want to hit home today, because when we talk about minority health and awareness, we've talked about in the past, just in general, people finding that doctor that they can go to get that checkup. If you are of a certain age, you need to get that colonoscopy. You need to make sure you have that mammogram. All of those things are important. And you can't just say, oh, well, I don't have a doctor when that awareness month comes around. You find a doctor that works for you. We've got community organizations and community health centers in our communities that are placed where everybody can get to them. And they are there to help you no matter what you can afford to pay. Please reach out, make sure you make that connection, because early detection with all of the things that we talk about, whether it's prostate cancer, colon cancer, whatever, early detection is key. And you don't want to go to the emergency room when you're feeling bad. You need to have that doctor that you can reach out to. Also, I know it's easier said than done, because I'm trying my best to fit it in. Healthy eating and exercise. We say that, but really taking that time, if it's 10 minutes a day, you find some time to exercise. If it's a walk around the block, if it's turning on a channel like Jammin 98.3 and dancing to it, you've gotten your workout in, that's for sure. And the last thing, just dealing with COVID-19. This has been quite a journey for all of us, but for people of color in particular, we know that it has really shined a light on what has always been there. So if we could, I'd like to wrap up with Dr. Tam, for those people who are still grappling with whether or not they should get the vaccine. What do you say to that?
Yeah, thank you for the question. I think this is a really important point. First, I would say that whatever process you need to understand, get knowledge, get comfortable, do it and take it. rather than making a top of the head decision that is misinformed with myths, or what, your cousin, brother, uncle Charlie said, about the vaccination. If there's anything that we know and are overrepresented related to COVID-19 is that it's a very real disease. It's affected us disproportionately in too many areas. And sometimes, because of our lack of knowledge and our willingness to learn, we become victims. There are so many things that we've learned about this disease over the past year, and there's of all the things I think that we can do. Prevention, certainly being in the environment to make sure that you're not susceptible, to it. Vaccination really is going to be the game changer in terms of ensuring that communities are there. I would love that our narrative is not that it's always a story about how we're disproportionately affected, or we have such incredible health disparities when it comes to condition XYZ, especially COVID, but more so that we are overrepresented in wanting knowledge, spreading truth, wanting to keep ourselves safe and protected. There are a number of voices of color, Black doctors, myself, that are willing to sit down and talk with people and take them through the journey to understand about the vaccine, what's in it, what will it do, which one is the right one for me. And we are so open to be able to do that. So it's an open invitation, I think, to this community to say, learn, know what's right for you. And it's okay if there's a bit of a journey related to it, but know that the sooner that all of us can get to a place of safety and vaccination, the sooner we can get to a place where we can actually do things like this in person, see your loved ones, without fear of contracting the virus, and being in community again, because I'll tell you, this isolation that's been experienced by our community, related to very good measures that we had to do to stay safe, has impacted us so dramatically, and we're suffering, for it. Some of us still have to go out, and do the thing and be at risk. But on the flip side of it, the isolation is really deep. So if there's anything that we could do, and certainly our ministry in Wisconsin, Ascension, Wisconsin, has been on the forefront to speak to people of color, of all backgrounds, all intersectionality of the demographic there. So if you want more information, I'll share the website in a little bit, when you're ready for that, Andrea, in terms of where you can go and get information and speak to qualified doctors who are culturally confident. I love that word. Thank you, Dr. Gina, as well as culturally humble, to know that maybe we don't know everything, but we know that this is right.
Yes, and this is a great time for everyone to give out their websites. And I don't stop at websites, because we do not assume that everyone is connected to the internet. So if you know someone who's not connected and you're watching this, please pass it along and share any information that you think will help make a difference. So if you would, go ahead, Dr. Tam, with your website and phone number, please.
Absolutely. I'm going to get back to you on the phone number, but certainly our website is getascensionwisconsincare.com. I'll say it again, getascensionwisconsincare.com. All
righty. And Gina, if you would.
Absolutely. Our website is WAI.WISC, that's WIS as in Sam, C as in cow, .edu.
And Dr. Smith, is there anything you'd like to share with us as far as website, phone number, anything in particular?
Yeah, I can give all. I'm at Blaquesmith.com. That's BLAQUESMITH.com. And the number's on the website, but it's 414-501-3622.
I just want to thank every one of you for joining us today. It has been a pleasure talking to you, Dr. Tamarah Duperval-Brownlee. She's the Senior Vice President and Chief Community Impact Officer at Ascension. Gina Green-Harris is the Director of the University of Wisconsin School of Medicine and Public Health Center for Community Engagement and Health Partnerships in Milwaukee. And Dr. Kweku Smith. He's a licensed psychologist in the state of Wisconsin, and his company again is Blaquesmith LLC. That's going to do it for Jammin 98.3's Conversations About Health during this Minority Health Month. It's been brought to you by our friends at Ascension, Wisconsin. Your care is our calling. We are Wisconsin, and the Wisconsin Alzheimer's Institute. Thank you all again, and have a great day.